Hoarding disorder is a complex mental health condition. It involves the persistent difficulty in discarding possessions. This difficulty arises regardless of their actual value. Individuals with hoarding disorder experience distress at the thought of parting with their belongings. This often leads to severe clutter in their living spaces. This clutter can significantly affect their daily life and well-being. Hoarding disorder can have a profound impact on an individual's personal life. It often starts with the simple act of collecting items, but over time it can spiral out of control. The accumulation of clutter in the home often leads to cramped and unsanitary living conditions. These environments can become breeding grounds for bacteria and pests, making it difficult to maintain a healthy living space. This can pose health hazards, increasing the risk of fires, infestations, and falls. The clutter can block exits and make it hard to move around, which is particularly dangerous in emergencies. Moreover, the constant struggle with clutter can lead to significant emotional distress, including feelings of shame, anxiety, and depression. The overwhelming presence of items can make it hard to relax and enjoy one's home. The overwhelming nature of clutter can also make it challenging to perform everyday tasks. Simple activities like finding important documents or even a pair of shoes can become time-consuming and frustrating. Cooking, cleaning, and even moving around the house can become difficult and time-consuming. The clutter can obstruct pathways and make it hard to use appliances or clean surfaces effectively. This can further contribute to feelings of being overwhelmed and losing control over one's environment. The constant battle with clutter can erode one's sense of peace and well-being, making it hard to find solace in one's own home. Hoarding disorder often leads to social isolation and strained relationships. Individuals with hoarding disorder may feel embarrassed or ashamed of their living conditions. This can make them reluctant to invite friends and family into their homes. As a result, they may withdraw from social gatherings and avoid contact with loved ones. The secrecy and denial often associated with hoarding can also create tension and conflict within families. Loved ones may struggle to understand the behaviour. They may feel frustrated by the individual's inability to part with their possessions. This can lead to arguments, resentment, and a breakdown in communication. Hoarding disorder can also have significant professional repercussions. The disorganisation and clutter associated with hoarding can spill over into the workplace. This can manifest as difficulty meeting deadlines, keeping track of appointments, or maintaining a tidy workspace. This can lead to decreased productivity, strained relationships with colleagues, and even job loss. Furthermore, individuals with hoarding disorder may struggle with time management. They may spend excessive amounts of time sorting through and organising their possessions, both at home and at work. This can detract from their ability to focus on work-related tasks and fulfil their responsibilities effectively. Recognizing the symptoms of hoarding disorder is crucial for seeking timely intervention and support. This mental health condition can significantly impact an individual's quality of life, making it essential to understand the signs early on. One of the most prominent symptoms is the persistent difficulty discarding possessions, regardless of their actual value. This can lead to an overwhelming accumulation of items that may seem trivial or useless to others, but hold immense significance to the individual. Individuals with hoarding disorder experience strong emotional attachments to their belongings. These attachments can be so intense that the thought of parting with any item, no matter how small, can cause significant distress and anxiety. They may have difficulty letting go of items due to sentimental value, fear of waste, or the belief that they might need them in the future. This fear often stems from a deep-seated anxiety about losing something important, or the potential regret of discarding an item that could be useful someday. Another common symptom is the accumulation of clutter in living spaces. Over time, this clutter can grow to the point where it takes over entire rooms, making it difficult to navigate and use the space effectively. This clutter can include a wide range of items such as newspapers, magazines, clothing, containers, and broken appliances. The variety of items kept often reflects the individual's belief that each item has potential value or use. The clutter often makes it difficult to use living areas for their intended purposes. For example, a kitchen might become unusable for cooking, or a bedroom might be too cluttered to sleep in comfortably. It may even render rooms unusable. In severe cases, the clutter can pose safety hazards, such as increased risk of falls, fire hazards, and health issues due to unsanitary conditions. Unraveling the root causes of hoarding behaviour. While the exact causes of hoarding disorder are not fully understood, research suggests that a combination of factors contributes to its development. These factors can be broadly categorized into genetic, environmental, and psychological influences. Genetic predisposition appears to play a role, as hoarding behavior often runs in families. Studies have shown that individuals with a family history of hoarding are more likely to develop the disorder themselves. This suggests that there may be inherited traits that make some people more susceptible to hoarding. Traumatic life events, such as the loss of a loved one, a serious illness, or a natural disaster, can also trigger or exacerbate hoarding tendencies. These events can create a sense of loss and insecurity, leading individuals to hold on to possessions as a way to cope with their emotional pain. The trauma can make it difficult for them to let go of items, as they may associate these objects with safety and comfort. Furthermore, underlying mental health conditions, such as anxiety disorders, obsessive-compulsive disorder, OCD, and depression, are frequently associated with hoarding disorder. These conditions can intensify the fear of losing items and the distress associated with discarding them. For instance, individuals with OCD may experience intrusive thoughts about needing to keep items, while those with depression may lack the motivation to declutter. These conditions can contribute to the anxiety and distress surrounding discarding possessions. The emotional attachment to items can become overwhelming, making it nearly impossible for individuals to part with their belongings. This can lead to a cycle where the accumulation of items exacerbates their mental health issues, creating a cluttered and chaotic living environment. They can also make it challenging to manage the emotional and behavioral aspects of hoarding. Effective treatment often requires addressing these underlying mental health issues through therapy, medication, and support groups. By understanding the complex interplay of genetic, environmental, and psychological factors, we can better support those struggling with hoarding disorder and help them lead healthier, more organized lives. Prevalence of hoarding. Statistics in the UK. Hoarding disorder is more common than many people realize. While precise figures are difficult to obtain, research suggests that hoarding disorder affects approximately 2 to 6% of the UK population. This translates to a significant number of individuals and families grappling with the challenges of this complex condition. Despite its prevalence, hoarding disorder often remains hidden and undiagnosed. The stigma surrounding mental health issues, particularly those involving clutter and disorganization, can prevent individuals from seeking help. This highlights the importance of raising awareness about hoarding disorder and encouraging open conversations about mental health. Seeking help and support. Overcoming hoarding disorder. Overcoming hoarding disorder requires professional help and a multifaceted approach to treatment. Cognitive behavioral therapy, or CBT, is considered the most effective form of therapy for hoarding disorder. CBT helps individuals identify and modify negative thought patterns and behaviours related to hoarding. Medications, such as antidepressants, may also be prescribed to manage co-occurring mental health conditions like anxiety and depression. Support groups and self-help strategies can provide valuable resources and a sense of community for individuals and their families. Conclusion. Understanding for a healthier future. Understanding hoarding disorder as a complex mental health condition is crucial for fostering empathy, reducing stigma, and promoting early intervention. By recognizing the symptoms, understanding the underlying causes, and seeking appropriate treatment, individuals with hoarding disorder can take steps towards regaining control of their living spaces and improving their overall well-being. It is important to remember that recovery is possible with the right support and resources.